Joining me now is Dr. Dimitri Daskalakis. He just resigned as the director of the National Center on Immunization and Respiratory Diseases. He was clapped out today, I should add, by current and former employees today. You can see him walking out there with flowers. There were hundreds of employees who clapped out the team who resigned. It's great to see you. I know the last 24 hours have probably been an incredible whirlwind for you, and I think so many people out there watching are just trying to figure out what is going on. And I have a lot to ask you about, but I want to just start by asking you about what it felt like today to walk out there and have so many of your colleagues, so many people clapping for you. What was that moment like?
So I didn't expect it. I know that we were going to walk out and have some folks clapping, and I expected to see 20 or 30 people. And instead, there were hundreds and hundreds of people. And also there were folks in the public health service and the commission corps who were saluting us from a distance. And so, I was really overwhelmed. I mean, I think, I was crying, walking down that path, both with joy as well as with sadness, because they're the people that make CDC great. And, sort of living where we live now and sort of seeing how public health professionals have been dehumanized, people really need to see that human moment, that the people that they're seeing in those images that you're playing right now are the people who do everything with such enthusiasm and so much love. It's the people that make sure that the U.S. stays healthy and that it stays safe. And so as people, try to dehumanize public health workers through mis and disinformation, those images are burned in my mind as something that really reminds me just how much CDC should be and could be about love.
It's such an important point. I had the honor of working for two presidents, and the overwhelming majority of people who work in government are apolitical. They're experts. They're nerds in the best way possible, and that's who runs government. You wrote this. I just read a number of parts of it, but you wrote this incredibly powerful letter. I read it a couple of times, and I just wanted to ask you about some of the things you said, because it was all in your words. You wrote, "I am unable to serve in an environment that treats CDC as a tool to generate policies and materials that do not reflect scientific reality and are designed to hurt rather than to improve the public's health." That is a very direct statement. And I think for those watching who are worried, they're worried, what are they going to gain access to? What does it mean? What should they listen to? Tell us more about what does that mean? And how should people understand it who aren't experts and haven't worked in the CDC?
No, thanks so much for that question, Jen. And I think I'm going to start by saying I'm a doctor. So I see patients. I'm a clinician. And when I was in medical school and I finished, we raised our hands and made that Hippocratic oath that said, first to do no harm. And I'm seeing CDC being transformed into a weapon where people are not allowed to share scientific data, and that scientific data is potentially going to be contaminated more and more with ideology. And so as a clinician, as a doctor, I see that is harm. And I see that if science isn't able to shine through the ideology, then what we are going to see is a lot of trouble, both in sort of what my health is, what my kids' health is like, but frankly, also national security. So, I could no longer be party to seeing the transformation of my brilliant scientists into something that could potentially hurt children.
Was there one moment that led you to decide that pushed you over the edge to resign?
Yeah. I mean, it's really been a death by a thousand cuts. So I think in my letter, I have a list of some of the things that I experienced. I think that, some of the things that stand out, I think some people may recall that recently Secretary Kennedy put out a directive that changed the childhood immunization schedule and also the adult immunization schedule for COVID-19, making it more restrictive for children. That means limiting access, by the way.
Yeah.
So making it more restrictive for children and also for pregnant women. And I'm never going to forget how I learned about it, which was on Twitter. So I was sitting in a senior leader meeting. I am, one of the COVID experts, one of the vaccine experts, and at a senior leader meeting at CDC, my phone blew up. And it was people saying, we didn't know that you changed the vaccine schedule. And then they said, there's this video online that you can see. And that's how we learned about it. And then we had to ask for, can we get some paper? Can we get something in writing so we can figure out how to implement this directive, since all we had was the video? We eventually got the paper. And, my job as a scientist is to say, can we also see the data that led to that decision? And that data was never provided to CDC.
No, because it probably wasn't based on data, I don't think. I mean, right. You were the medical expert, but that's the core issue here at play, it feels like. One of the things you also said, which I wasn't aware of, is that you said in your letter, we are now 7 months into the new administration and no CDC subject matter expert from my center has ever briefed the secretary. And I've never worked in the CDC, but I spent a lot of time in government, and I can tell you that is completely abnormal. It is the experts who should be providing the information and updates, and most presidents want that information. Most secretaries want that information. But how abnormal is that? Like, how often would the secretary be briefed by experts in the CDC?
It's extremely abnormal. And so I think having been in federal government for 5 years and local government for a long time as well, experts are really sort of the key individuals that brief principals, so brief the secretary and secretary-like individuals so that they're able to really guide their thinking around policy. So it is true that my center covers measles, COVID, flu, polio. I have a long list of things that the secretary really should be briefed about. And I'll also add that I had the opportunity to interact with some of his staff from the office of the secretary in big senior leader meetings where I explicitly said, we have never briefed the secretary on anything. Yeah. We would really appreciate the opportunity. Measles, obviously, is something that he has said a lot about. I have no idea where he's getting that information, but it's not from CDC experts.
Probably not from medical experts, I suspect, if it's not aligned with your thinking. You also said, I know I keep bringing up your letter because it was so powerful. Everybody should read it. We'll post it. You say eugenics plays prominently in the rhetoric being generated. I think anybody who's been paying attention would agree with you. But from your perspective, tell us more about what you mean by that.
Yeah, I mean, I think that the whole rhetoric behind the movement that Secretary Kennedy thinks that he's launched is really that only the strong survive. So whether it's cutting social programs that are important to children, whether it's cutting access to food, so making America healthy means good food. So cutting things like food benefits for children seems like it's not a really good idea to be able to achieve that end. So, I think that, and, he clearly has a belief, if he actually does believe in viruses and bacteria, which I don't know if he actually does, in the fact that they exist. But, he has this belief that sometimes infection is better than vaccine because, it creates, I think, the people who survive are the people who should continue to propagate the species. I'm never going to forget, there was an interview that he did at a restaurant talking about the importance of using beef tallow in French fries. And in that interview, he was talking about his desire to have avian flu burn through chickens. And the chickens that survive, they're the ones that should be bred. Those are the words that he said. They're available to watch. And he said, because those chickens have the superior genetics. And then 1 minute later, he said that the president also has superior genetics. So, I mean, from my perspective, as someone who, has sort of the cultural background of a grandfather who was killed fighting fascism in Greece, that's sort of like embedded in my brain. And I heard that and I'm like, so that's what this is all about. So, if there are kids who get infected and do well, that's great. We shouldn't be giving them vaccines, I guess, so that we can really propagate the strongest of the species. I feel like what he said about chickens is what he believes about people. And that's scary. And America should know that. So it is there is a fundamental thing happening here that I think we all resigned, the three of us, Dr. Hari, myself, and Dr. Jernigan, to raise the red flag that something is extremely wrong and dangerous in this country.
It is so powerful what you're doing. I think people are so scared out there. Public health is such an important part of our society and our community. And I have no doubt, I have a Greek grandfather he's passed away, but who also was a doctor. I feel very connected to you. I have no doubt he would be very, very proud of you. Thank you for being so vocal and for being here with us tonight. I really appreciate it.